Alrighty, we are live. So I'll just start. Thank you again, Dr. Nelson, just for being with us and just coming to talk to us. I'm just going to start by introducing you, and then I'll start with a couple of questions. So today we're doing marriage and starting a family while in medicine. And we're here with Dr. Colbert Nelson. He is a current assistant professor in the Department of Family and Preventative Medicine, as well as sports medicine at the University of Oklahoma Health Science Center and OU Health. He's from Little Rock, Arkansas, went to medical school at William Carey University College of Osteopathic Medicine, and is an alumni of both University of Missouri Family and Community Medicine Residency and Sports Medicine Fellowship. His interests include sports medicine, exercise and nutrition, ultrasound, education/mentorship, ambulatory and inpatient medicine. He's currently involved with sports coverage of various levels, teaching medical learners, growing his own skills in clinic and mentorship. In his spare time, he likes to relax with his wife, Raven, their 2 children, and dog, Bishop. So again, I've said this like 3 times now, thank you, but thanks for joining us. I think this is a topic that can be difficult to talk about, and sometimes it's hard to be transparent about it. So I'm really interested in hearing what you have to say. And maybe you can just start by telling us at what stage in your training did you get married, and how did you decide it was right to get married during your training?
Yeah. Seems like forever ago. I got married between my first and second year of medical school. I won't say what year, but that was when we decided. Mainly because that was the only time that we thought, kind of understanding the journey ahead of us, that would be enough time to really enjoy it compared to second year, third year, fourth year. So yeah.
That makes sense. Um, so I guess since it was so early in medical school, how would you say medical school impacted your relationship, and what kind of helped you almost protect your marriage during that season? Because medical school is insane. So what would you say helped you?
Yeah, I mean, medical school definitely is not going to be like the thing that turns it around if it's already in trouble. So, I mean, of course, in any situation you're getting married, you want to have a good, solid foundation and all that kind of stuff. But yeah, medical school is taxing. Time, attention, emotional, just like everything just kind of goes into it. And it's draining. I mean, you have to obviously have your priorities. Um, Try to spend time with your significant other whenever you can. Involve them in anything that you can. I mean, we did a lot of random stuff. Yeah, sometimes I look back, I'm like, man, I don't know, but yeah, just got to go for it. Hope that they understand like what you're doing, why you're doing it, what the outcome is going to be, which is, hopefully a better, at least financial, and steady outcome in terms of career. And then just gotta figure out what else is important to you and make it through.
Hmm. And is your partner also in medicine or something
No,
totally
she is
different?
not. She is as far away from medicine as I think you could get. Um, some people meet their person and they're both doctors and all that stuff. Like, cool. Maybe if life was different, that would have been me. But no, I enjoy having somebody who is not in my career field. So
Hmm.
when you get home, you want to leave it, at work. So I can talk to her about stuff, and she now it's like The Pit, but before it was like Grey's Anatomy, and she'd be like, "Oh yeah, I saw that on." That's like the closest she would get to understanding it.
Hmm.
Not, somebody who's in my grade or a different service, and they're like pimping me. So, different strokes for different folks, I guess.
So I guess I know you said that for medical school, at least, it was pretty difficult, obviously. Would you say that there were greater challenges in residency, or do you think that it got easier in residency because you have a little bit more stability, or would you like say it was more difficult than medical school?
I don't know if I can say if it's like necessarily more or less difficult. It was different. Um,
Hmm.
Third and fourth year, especially fourth year, you're kind of winding down. You have more time. COVID happened, so like literally nothing was going on. I just got to chill at home. Um, and then, obviously the move and everything, going to a different location for residency, and then residency starts, and you're pedal to the metal. At least for my specialty, family medicine, a lot of hospital time and nights in clinic your first year. So that obviously takes a lot of time away from your significant other. Let's see. Yeah, so I mean, different. It's different. You have more responsibility. You're a doctor, quote unquote. Um, Try not to feel like you don't belong, but also trying to feel like you know what you're doing, and all that kind of stuff goes into it. But it was nice to make money. Definitely making some money. We were moved from an apartment in medical school to a house
Mm.
in residency. Um, Able to contribute a lot more than just kind of telling her, just wait until I, match, and then we'll be better. So, in some ways, it was better being able to really help support some things. But yeah, time, if you're on nights for 2 or 4 weeks at a time, it's difficult to sync up with your partner.
Hmm.
So as long as they understand that as best as they can, and you do little stuff, notes, pictures, messages to each other. Like you just got to do the best you can. But
Okay.
different, definitely different.
Different. I guess now, like looking back, is there anything you wish you would have known about balancing marriage during training?
And I would definitely say yes. Uh, um, I would say one thing would be being present with my partner. So like the times where we did have time together, either in medical school or residency or fellowship, but fellowship was a lot better. Um, Being present, not like being distracted or um, talking only about work, or not being completely into their day and their journey just as much as they are into you. Like, yeah, you're working to be a doctor, but like, I mean, personally, like, I don't think it's that big of a deal. You're not any more important than anybody else in like the medical team. And I don't think being a doctor makes you any better than anyone else, period. So if your partner is like a cashier at a gas station, like you should be giving them just as much time and attention and love when you do have the time as you can, because that time doesn't come very often. Uh, it was also a little bit different too, just because of COVID, like the pandemic. I was afraid to like get my wife sick and stuff like that, so that I was that caused me to be more cautious when I first get home from like the ICU or the hospital.
Hmm.
That plays a part in it too. We couldn't go out to restaurants to eat there. We had to basically get everything to go. But I mean, we still just got to do what you can, whatever the situation is. Find that common ground, make time. There's definitely, you can definitely not have time, but you have to make time. You have to.
And do you have like intentional time set like away from work, or is it just like as soon as you come home from work, you're just no more work, you're only home?
Now I do. Yeah.
Okay.
Uh, in residency, first and second year, not really. Like I would work in bed, I would do notes, whatever, respond to emails all the time. Versus like third and fourth year, I kind of tried to isolate work from play. Our family grew my third year, so that obviously had its own separate challenges. Um, as best as you can, yeah, I would say it's better to have an idea of time, even if it's I'm gonna help my significant other cook, or my wife was really into the Real Housewives of fill in the blank Atlanta. So it would be like, I don't want to watch this at all, but I'm gonna take this hour to like drop everything and just like watch the craziness unfold. Um, and I mean, then I have to get back to work, and as long as you'll both understand that, then you just gotta do what you gotta do.
So a lot of kind of like compromising where you can and like fitting things in where you can, but at the same time like not trying to like I guess being intentional about your time and not trying to like do two things at once all the time, sometimes giving all the attention in one area to your
Yeah,
partner.
and just don't have a big head. Like I said, like I'm a doctor. All of y'all who are watching or listening or whatever are going to be doctors in the future. Like that doesn't inherently make you any better than anyone else, or you have suddenly more value than anyone else. I would say, especially your significant other, whoever that might be. So, you know, yeah, you got a lot of stress and things to do, but so does everybody else. You gotta acknowledge like what you're doing is important, but what other people are doing are also important, and live your life that way. That's how I kind of see
Hmm.
things.
Hmm.
Um, so yeah, just make time. Like if something's important to you, make time, even if it's 10, 15 minutes. Just make the time.
Hmm. um so you had mentioned that your family grew in third year of residency. Was that what you said? Okay.
Yeah.
So I guess we can kind of talk a little bit about like starting a family in medicine and kind of move on a little bit to that too. Um, was that something that for you, you kind of knew third year was the best time to start growing your family, or for you, like I guess like what do you think is the best time for us out here to like start growing families and things like that? Because I know some people want to wait until all their training is finished because they have specific goals in mind and don't think it's going to be easy with a family, while other people kind of have the mentality that's like, there's no great time. Like you just got to figure it out. So like for you, what do you think your like mentality was?
Um, I would say number one, like I come from like a place of privilege as a male in that dynamic. So for me, like the weight of wanting to build a family and being pregnant and all that stuff, like I didn't have to do.
Hmm.
Um, so acknowledging that, number one, no time is a good time. I would say medical school, residency, whatever. For some people, that is like putting off family building until they achieve their career goals, which is more than appropriate if you and your significant other are on the same page. Vice versa, if y'all are like, I want 10 kids, you don't want to really be putting that off necessarily. So as long as y'all both understand the changes that are going to have to happen and the give and take, then, start as early as you want to. I had several friends in residency who were women who built their family and they had their own like struggles and things of that nature that I can't even like begin to try to comment on. But for me, we didn't have a golden time in mind. It was a combination of just the process, and we did have some like fertility struggles that played a part in it as well. Um, so we were just happy to get to that point, at least initially. Yeah.
Okay. What, I guess, like, what was there like a hard transition from, I know you said that you didn't have to deal with a lot of stuff as a male, but like I'm sure there's still like things with like transitioning to being a father while in medicine that could be difficult. I guess like just were there some difficulties with transitioning into that role and responsibility, and like what were they?
Absolutely. Um, yeah, absolutely. Like, I mean, I would say even just from, my wife being pregnant and, I'm trying to make all the appointments and doing everything that I can do to try to be as supportive as I can, whether it's, doing more like cooking, cleaning, or trying to do more like, I don't know, foot massages or something. Like, you have to have this. I didn't have it at the time, but I think you have to have this understanding that you're going to try to do the best you can as a partner, but the best that you can might not be what your partner like needs to be like fulfilled. And I struggled with that because I'm like, I'm like, I'm getting home and I'm trying to do X, Y, Z and help around the house and do this and do that. And oh, so we're good. And like, that's not necessarily the case. And that's selfish of me to think like that. Because, with my time that I can give to us, I get a pat on the back because it's me. Like, no. Um, and I didn't get that at the moment, but obviously some more years have gone on, and that's something that you both have to be okay with and be able to talk about. Is I'm going to do the best I can on one side of things. She's going to do the best she can, or whatever your relationship setup is going to be. But just because you're doing the best you can doesn't mean that you're going to meet all the needs of your partner. And as long as there's like a communication or an understanding, there's not like a guilt trip that goes on in there, or there's grace, I think it'll be fine. The issue is when you don't understand, or you think things are okay.
Hmm.
uh, Also, once we did have our son, um, I had 2 weeks and then I had to go back to work and I was on nights. So, being home and being able to help and change diapers and do all that stuff. My wife was breastfeeding our son, so as much as I could help with that, which was, do what you can. Once again, like, you also have the responsibilities as a medical student, resident, fellow, whatever the case may be. And so you do have to keep everything else in perspective as well. So once again, I think I'm trying my best. I got to go to work. I have to do X, Y, Z, come home, and I'm still trying to do everything I think I can do. That's great. Like, pat on the back for me for that, but also like, understand that just because you're given everything that you think you can, it's not necessarily gonna it. I mean, it might be everything that your partner needs, but it also might not, and both of y'all have to be okay with that. that your partner's not necessarily getting everything that they need, but they understand you're doing the best you can, and also that grace of I'm doing everything that I can within like where I am in life, and I I know that I like want to do more, I want to give more, but that's just not possible right now. Um, yeah, so grace is huge for for that. Yeah.
Do you feel like you had like kind of like this idea of grace? Did you have a similar mindset for like maybe like missing family moments or having to leave work early? Is that like something you also had to do for those instances?
Yeah, and I think that's maybe more like depending on where you go for residency or what your specialty is. You know, if you're in your second, third year of your ortho residency, that's going to be a lot different of requirements and stress than if you're in your second or third year of like psychiatry. I definitely made the effort to try to go to as many things as I could, both like prenatal and once our son was there, including checkups. There are some things that just made it easier for me, like our pediatric clinic was in the same place as my uh, family medicine clinic, so I could just run upstairs during a visit. Um, just once again, it has to be like a communication on what is actually doable. If your partner thinks that you're going to be at every single anything for the kid and you're still in training and they don't understand your dynamics and you don't understand their dynamics, being on the receiving end of knowing that you have, a residency job, but also like knowing that they're just as important to the relationship as you are, like you got to communicate or you're going to get some type of misunderstanding and then things will go left. Um, yeah, it's looking back on it, it's it should just be a lot of communication and grace.
Hmm.
That's like the running thing, I would say, at least for me in my perspective.
Okay, thank you. Um, I guess did you guys also have like other systems that were helpful, like childcare? Are you close to family? Did you have like anything like that?
So we were very far from family, so that was not the best. I think the closest family we had was like 6.5 hours away. Childcare, we had our son in daycare um, as early as we could, but for all those thinking about trying to like start a family, like the day that you find out y'all are pregnant or expecting or you're thinking about it, you need to reach out to daycares and get a spot as quickly as you can. My wife and I were talking about it. I think I reached out during her third month of being pregnant, and our son started when he was 4 months old. So what took 10 months to get in, um, and that was more kind of luck than anything else. Um, and I mean, obviously, having family closer would have helped with that. You gotta know that kids are expensive, so you gotta make sure y'all aren't living crazy, like paycheck to paycheck, partying and stuff before eating out every night, because that's just not going to be what y'all can do, what y'all can manage. Um, no, honestly, you just got to make it work. I think looking back, before we had a kid, like I could try to think of all the different ways or all the different jobs or activities I needed to be ready for in that first 6 months, 1 year of life. But once you're in the situation, like you just have to go, just have to figure it out. And that goes back to like that foundation, and hopefully you have somebody you're with who, yeah, y'all might fight or argue or disagree, but y'all are gonna be there for each other. 'Cause that's what really kind of counts. Like, if your kid's sick and throwing up, one of y'all, if both of y'all work, one of y'all is gonna have to leave work to pick up your kid. If your kid has a fever, one of y'all are gonna have to pick him up. If your kid can't go to daycare, someone's gonna have to stay home with the kid. Like, both of y'all have to understand that and advocate for each other and yourself. Um, I was, my wife was kind enough, thinking back, where I don't think I called in any days specifically to take care of my kid if and when he was sick. Um, I can remember. So that's like a blessing that other people might not be able to experience. Vice versa. We had two cars at the time, so I would typically like either pick him up or drop him off at daycare, and she would do the other. Uh, so that helps take the stress off from each other too. Just whatever your situation is, you gotta make it work. Not just for you and your partner, but you're obviously your new addition to the family. So you want to do right by them.
Mm-hmm. Mm-hmm. So I didn't know this. I didn't realize that daycare was something that it was like you had to apply to and think about and
Oh yeah, I didn't
figure.
either. I didn't either until I had to. Yeah. And depending on like what, if you're trying to get into some like hoity-toity place, you gotta do stuff. Or if you're just trying to get into like your churches, daycare, you still got to do it early. Um, that's like the biggest thing is get a spot or try to get multiple spots where they all know you're trying and you're on the wait list. And then when you get it, you got to, you know, keep it and be happy with it. Like we loved the place we ended up, but it wasn't like the place we thought of when we were first looking. But our kid, like, he thrived there, and we loved it, and they loved him, so it was perfect. But it still took 10 months. So yeah, I would definitely talk to relatives or friends who have children just to get like some of that second level understanding that you just, at least I didn't have going into it. Yeah, whole different ball game. Like having
It sounds like applying to med school all over again, but for the kids.
I mean, I guess it kind of is. I mean, even just going to the store, going to the store before you have a kid versus now you have like an infant, like that is a very different process. Um, Going out to pick up some food because you don't want to cook, it's a very different process. Blowouts, throw up, you got to be ready for it. It's just a part of it.
Okay. Um,
Hopefully,
and
I'm not scaring anybody.
hopefully, I think that you're saying a lot of things that are important. I think less scaring and more
I
encouraging.
have I have thoroughly enjoyed every single second of being a father, except driving home today because they were both screaming and crying. It was bad, but otherwise, I've loved it from the time he was born to now. He's doing all his stuff at almost 4 years old, so it's worth it.
I mean, that's great. I feel like you seem like you've been able to like reflect a lot and kind of figure things out as you go and figure out how to make changes. So, um, I mean, this information is helpful for me at least. I don't know about anybody else listening, but it's helpful for
I'll
me.
take, hey, as long as it
I'll
helps somebody.
take it. So just kind of like, I guess you're like a part of a lot of things. It seems like you do a lot of things with sports, teaching, you like to do mentorship. And then obviously you have a lot of your clinical responsibilities as well as like a lot of other responsibilities and hobbies. How do you like stop yourself from like overcommitting, basically?
I mean, I'll be honest, a part of it I'm still trying to figure out. Um, I, I don't, that's a tough one. I mean, you got to do what makes you happy and what brings you joy and what got you to that point in the first place. So if you're really big on doing like community outreach and doing research, like just because you suddenly are married or just because you suddenly have your kid and your family's bigger, doesn't mean that you need to throw or should throw all of that away. At the same time, that also doesn't mean you should just like ignore your family and keep being selfish and doing what you want to do. Like you have to find a middle ground. So like for me with game coverage, like I still cover sports, different teams that we have to cover here. But I make sure that my wife knows ahead of time, like these are the dates I signed up for. I'm gonna be going from like 7 to so and so. She'll know either to like put them down because I won't be home by the time they go to sleep, or can keep them up a little bit later, like 15, 30 minutes extra to me to see them when I get home. And then I also do the best I can to like uh, tell her that like I appreciate her or I thank her for doing that. Sometimes I'll try to bring some food to help take a little bit of pressure off of her. And then, obviously, like I, I personally can't help but feel like I have to like not make up, but not make up time, but just like be more present and there for my kids, like the next day or sometime in the following days. Um, Even though I know they don't care at all, more like a me thing. Yeah, sorry. So right now she's watching the kids. My phone's charging. She brought me my phone so I can order food. So then she can go get it when I'm done. And then we
Mhm.
can eat and hopefully not be bothered by our kids. So, just gotta communicate.
Communication.
Never stops.
Have you like ever had to, I guess, like say no to a career opportunity for the sake of family?
Yeah, yeah, I would say so. Um, Maybe not like where it's just super in my face, like I'm picking my family over this and you can't tell me otherwise. But I mean, the job hunt, I definitely weighed family and location to a part of, why I picked where I picked for work. Um, Different conferences or opportunities. Maybe before I would go the entire time. Now it's like, like I had a workshop maybe a month ago. It was on like a Thursday, Friday. Um, the workshop started Thursday, went all day, and then it was an optional Friday. So I flew in Wednesday night and then I flew out Thursday night. So I try to keep as much time as I can, like at home or close to home. I'm sure I've turned down other opportunities. Like I think I was sick, or one of my kids were sick when there was a NBA like playoff game that I could have got an extra ticket to, but I was like, I got kids. I can't just up and leave. my wife unexpectedly to, do X, Y, and Z. At the same time, if you make that decision, don't then like try to guilt trip or make your significant other feel bad for it. Like you're a grown person, like you make your own decisions and live with them. Um, yeah, I mean, even way back when it was residency, even medical school, like I picked where I was going to go to medical school, like almost almost purely off of where she was. But that's what was important to me. For other people, like it might work great where they're like, you know, for the next 10 years, like residency, fellowship, whatever, like we're gonna just do whatever you need to do, and then after that, we're good. Like just once again, communicate, be on the same page. Yeah, talk a lot.
Mhm. And did you like, I guess for me, and I know probably a lot of people um, who are female, like they think about what their life is going to be like in terms of the specialty that they choose. And like that's a really big deal for me, at least, and what I would like to do and how. And I always like try to envision how a family and being married will fit in with my specialty. For you, even as a male, do you feel like the choosing family medicine was had a big part to do with just like wanting to be in a family, having your wife, or do you think you didn't have to think about it as much?
Um, so everybody's a little bit different. I would say like I always knew I wanted to be a husband and a father, so that like always kind of played a part in the kind of the background thinking of what my career was going to look like. Um, I mean, the family medicine part of things, I was going to go probably family no matter what. I have a background in public health. I came from not great circumstances, and I thought the best way to like give back is through family medicine. So that wouldn't have changed. But I mean, no, it's a part of it. I mean, even from like the job opportunities you look for, if I was weighing like, do I still want to do a fellowship now that I have a kid? Um, and I would say that's even the stress of like, man, I really don't want to start asking for time off here or there to go to my wife's like prenatal appointments, or I really don't want to cause any trouble, but I really want to go to like my kids' well child checks. Like even that little stuff played a part in it for me. So at the same time, I like I said, I had friends who were in residency who were female and pregnant and went through the whole gambit of still being on nights, still working hospital shifts, being in clinic, having to have time in their schedule to like pump milk for their kid. Biggest thing is like hopefully you're in a situation where you feel comfortable advocating for yourself. I hope that anyone listening to this or just in general, like you're at a place where you feel like you can at least like speak up about the things you want or need. And hopefully you have like a faculty and staff and co-residents who are also like reasonable humans. Um, so I mean, for me, like people knew once I was having a kid, like, yeah, Culpert's gonna maybe like leave early every now and then to make it to an appointment or the anatomy scan, like he's not missing the anatomy scan. So, but at the same time, I didn't, wait and communicate that the day of, or I didn't leave work any other time than when I needed to like do something. So I'm not like taking advantage of the situation. Um, Majority of the friends who I had who were pregnant and women, um, they before and after, like they're basically nothing changed. Like they're still doctors, they're still just as qualified or some of them are probably overqualified compared to me. They just had like a bigger belly that they had to like work around. So I mean, if you're not in a place that's like sexist and misogynistic, I don't think it would or should be a big issue outside of your own like personal struggles. And of course, if you have, if you're dealing with a difficult pregnancy, you got to be like on bed rest or something like that. That might change things, but at least in my experience doing family medicine, like if people have to miss extended time due to pregnancy related issues, or they want their full time of FMLA and they end up graduating late, like cool, that's what you do. Um, just hopefully you're somewhere where they work with you and you work with them. I don't think I was aware or thought about the concept of like people or like pumping breast milk, but on inpatient, one of my seniors, she had to pump like 2 or 3 times a day. Like, did that delay us rounding or seeing patients or responding to codes? Like, no, just had a little bit of extra like background noise, and she had like an extra bit of covering on. Like, a lot of it is you're going to overthink it, but as long as you can hopefully like advocate for yourself, say what you need, what you don't need, you just got to keep it moving. Be confident that you are getting what you need. Like if you say, I need to pump every 3 hours. I need to have like maybe like a 20-minute block in my schedule where I have to pump. Like that's the expectation. Like it's not a if this then that. Like that's what you need. That's what you should get. And if not, I'm sure you can like go through the appropriate channels to get that figured out. But please advocate for yourself or have someone else advocate for you. Like, doesn't matter who says it as long as it hopefully happens and it's a low stress environment.
Mhm.
Yeah.
And I don't know if you can kind of like going off of that, and I don't know if you can speak to this, but um, is asking questions about like what the environment is like during residency while you're pregnant and things like that, is that something that you try to feel out while you're on residency interviews or like ask questions? Like, should you be asking direct questions about that? I feel like I haven't heard any information on that.
Yeah. So once again, I'll go back to I come from a bit of privilege being a male. I brought it up on every residency interview I had because I knew for me, like that was a important thing was making sure I would be able to be as present of a father as I could be, support my wife as much as I needed to if and when that time came, and feel like I'm not being like punished for that. Um, from talking to other physicians who have different circumstances than me, I would say that it's important to ask, but it depends on like potentially who you ask. Um, if there are others who are interviewing or who are at that program who that were pregnant, have been pregnant, yada, 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 definitely reach out to them for like a first person perspective of what's going on. Um, that should also be something that I hope you feel comfortable asking or comes up during the just general like resident like benefits, like I don't know, you get this amount of money for food and this amount of this and this many vacation days. Oh, well, do we have to take vacation if we're like out for, a hospital procedure or something? Like it doesn't even have to be like bona fide, hey, I want to get pregnant or I want to have a family. You just want to try to get the information. Generally, I would say that the residents are hopefully going to be more open to it when you have like your resident dinners or your little parts during the interview process where you're only really talking to them. Uh, I would imagine there's going to be at least one physician, male or female, who's gone through the process of um, dealing with kids and all that stuff during training. So if that comes up in any way, shape, or form, you don't need to make like a big aha moment, but just write it down, reach out to them after if you're comfortable with that. Um, Hopefully, it's a part of the process and you just get that education. But I know, like I said, for me, it. I didn't realize it at the time, but now looking back, and it's completely different. Like the weight of me asking how much time am I allowed to have as a father is very different than how much time am I allowed to miss being pregnant. Potentially from both like your own like personal feelings and uncomfortableness speaking out for, but also like the potential like stigma you could get from your program.
Hmm.
Um, I would say if you have a feeling of like discomfort from the answers that you get, that's probably a sign that you don't want to be there in the first place. If this is going to be a part of your future and you feel like the program you're looking at isn't going to support you, um, and then vice versa, if you're already at a program and things start happening and you feel like there's not support, like advocate for yourself. I hope that you have friends, family close by, and then also like be don't take being mistreated and being a resident as like this is okay. Like no, you are entitled to your vacation, you're entitled to your sick days, you're entitled to your FMLA, you're entitled to whatever else I'm not thinking of right now. So just be as on top of it as you can, ask as many questions as you can, but try to feel comfortable doing it. Especially like now for me, when I interview medical students, I usually bring up that when I interview people, like I got two kids, blah blah blah, and then you know me giving that information initially at the start of our little interview, 15-20 minutes might give that person who I'm interviewing that confidence that they can then ask that to me.
Hmm.
Just a very, very dynamic thing. Yeah.
Hmm. And I guess we have a little bit of time left, so I think the last couple of questions I have are a little bit more like not like a little bit more abstract, I guess.
Yeah, go
Um,
for it.
so I guess now as a father and a doctor, would you say that the meaning of like success is different compared to when you first started medical school and you were going through medical school versus now? And like how so?
I would say, yeah. Success before, I mean, when I was in medical school, success was just making it through medical school. But now, I think like for me, I've had to figure out what the best way to do my work is while also still giving my kids the attention that not not the attention I think they need or I think they want, but the attention that I want to give them when I'm home every day. So does that mean I need to do more work while I'm at the office instead of getting on my phone or going to talk to somebody? Like, yeah, I need to be more focused because that's important to me. Um, if it comes down to like, can I stay for this extra meeting or do I need to leave so I can pick up my kids on time before their daycare closes? Like, I'm gonna leave. Um, Definitely been more than a few times, and I would say I have the benefit of being an attending now, but there's definitely been a few times my kids have been sick, and I've said, "All right, I need you to cancel my clinic for the rest of the day," and I would never have considered doing that as a resident. I don't think I took. I don't think I took an actual sick day um, during residency. That's a whole different can of worms with toxicity and stuff like that, and like imposter syndrome. But now, like, I could care less. If my kid needs something or my wife needs something, like, buy, like, you can choose to not cancel my clinic, and you're just gonna have people show up. I'm not gonna be here. Just whatever are your values and morals, stick with. Um, and obviously, with more privilege, being a medical student to being a resident to being a fellow to being an attending, you get more leeway as well. So that perspective does kind of change. But I mean, I think I just kind of go back to, you're not truly going to know until you're like standing on the altar or in the chapel or in front of the people at the courthouse holding your significant other's hand, or holding your potential like baby for the first time, or you're in that situation for the first time. You're going to be very surprised at how you actually like respond to a situation. um, a couple years ago, like, a way I respond to something now would be very uncharacteristic, but now it's like, you know that's my kid. Like, I'm not gonna there's nothing that you could say to me that's gonna make me not go to them. Or my wife is sick or was in a wreck. Like, nothing that you're gonna say is gonna make me like not be there for them. uh, Punishment or whatever, uh, it is what it is.
And so this would be the last question, unless there's anyone who wants to ask a question.
Mhm.
I guess, how has becoming a husband, a father, how has that changed the way that you practice medicine?
Um, I think for me, it just gives me more common ground with patients. I like to think I am more of having a conversation with people than like doctor physician back and forth. So if they tell me that they're pregnant or they have kids, I'll say I have kids too. Or I'll have somebody come in, bring their kid who's sick. Before, I would just say in my head, like, based off of this PowerPoint or this chapter I read or these videos I saw, this is what I should say or do. But now it's like I've lived it, so I can, like, yeah, my kid is dealing with that. Or here's what I did when my kid had, uh, diarrhea and it kept being irritating. Like, I tried this, it might not work for you, but this is something that I came across. Like, just, it feels like you're just finding more common ground and more ability to like connect to your patients, because you've been in more situations that are similar to them than before. Um, yeah, it's probably more comforting for patients too if you're seeing their child or blah blah blah, and you can just say some easy words about how like you have kids too. Or um, I'll be looking at babies for well child checks. I'm like, I miss when my kid was this age, and we can kind of talk and joke and pass time with that. Just those little things. I think, in terms of my knowledge, you're technically not supposed, or I would recommend that you don't give your experience off as law. Like, if you co-slept with your child and things turned out great, technically based on like AFP and APA guidelines, like, you shouldn't do that. So you don't want to completely forget everything that you've learned from the books or the presentations or whatever, and just only give recommendations based off your life. But it does help, like, with just generally being more comfortable with each other.
Mhm. Mhm. And do you have any like last minute advice for medical students who want to have a strong marriage, meaningful career? I know we have grace and we have communication. Is there any last minute words you want to give?
Man, I guess I would say the thing that maybe's popping in the mind for me is like you're gonna have a lot of stress and a lot of ups and downs and a lot of like um, imposter syndrome. At least I did, and I'm more than happy to talk to anybody about that. Um, but remember, like the why. And I'm sure if you are in a situation where you're thinking about the next steps with your partner, whether that's more of a long term commitment to each other with marriage or just like a declaration of love. You decide to expand your family either by having children or adopting or fostering, whatever the case may be. Like, try to remember why you're doing what you're doing. For me, it was to give my family a better situation than I had growing up and, be able to do all the things that they want to do and just enjoy life with them and feel accomplished and feel like I've done something. And so like today when my kids were yelling and screaming in the car, like I just kind of laughed because is it what I want to have happening? No, I don't want my daughter to be screaming and then my son to be screaming that my daughter's screaming. But at the same time, like I have two beautiful, healthy kids. I have the job that I worked a long time to get to. Have a wife and dog at home. I feel like very secure and comfortable, and just that's my why. And last part is give yourself grace. Somebody, maybe my wife told me this. Um, so I have two kids. I'm in my early-ish 30s. Um, Tomorrow is going to be the first day that I live my life being married with two kids at the age that they are.
Mm.
Just because I have two kids doesn't mean I'm an expert. It's going to be your first time being married. It's going to be your first time having an argument with your spouse. It's going to be the first time you have tried to figure out what to do with a kid or kids. Like, give yourself grace. It's the first time you're doing it. Don't rush. Don't be stupid. But like, you're not expected to know it all. Like, I'm still figuring out stuff all the time. That's what I'd say. Yeah.
Wow. Well, thank you. I definitely got a lot from this. You didn't scare me. So, and I think we have somebody else in the chat who says she's not scared either.
Good.
Um,
I'm happy to
but
hear that.
we really appreciate you just joining us today and talking to us and giving us as much advice as you could give us from just like your perspective.
Absolutely. Thanks for having me.
No problem. Gonna end the stream unless we have any other questions.
I'll wait around and make sure.
See if there are any.
Not gonna hurt my feelings if they don't.
Okay. I'm gonna end the stream.
Okay.